All right, so I'm going to do a case that I saw recently, brought up some issues and potentially some controversy. So this is a 27-year-old gentleman who was involved in a motor vehicle collision whereby he was rear-ended about 6 months ago. The history that he's undergone an extensive amount of injections in his neck, which have included epidurals, ablations, facet blocks, and he also reports to me that he underwent a, quote, discectomy by a pain management doctor. And he presents with me with neck discomfort in the musculature in the back of his neck. He did not have any radiating arm pain, numbness, tingling, did not have any weakness in his arms or hands. It was just pain in the paracervical region in the musculature radiating from the back of the head down through the cervical spine. He had stated that the only thing that gave him relief was massage, but he's undergone physical therapy. He noted that some of the therapy that he'd done was very lackluster in terms of their focus on the musculature. And so he presented to me after many months of going through this process. And so I reviewed the MRI, come to find out the MRI is normal. This is his neck, this is his cervical cord, these are his discs. His disc heights remain good. There's no bony abnormalities, there's no herniation, there's no compression. When we do the axial through the MRI, we see the facets look good. He's 27, so they're not arthritic. The facets are good. There's no major arthropathy. We can see the nerves very well, that there's no compression on any of the nerves. As we go up and down the spine, all the nerves are wide open. Again, we can see the disc, here's the nerve, the facet joints look as they should for somebody in their mid to late 20s. The same thing here. I had to have the unfortunate conversation with this 27-year-old gentleman that his MRI is normal and he's undergone all these procedures that not only have not worked, have not been treated or not been treating anything. So the concern for me as a neurosurgeon and for many patients out there is that if you're in a car accident and you start taking direction from individuals and you're not getting better and you're starting to question what's going on, I would highly recommend you get a second opinion. Your attorney should not be driving your medical care. If your pain management doctor is recommending procedures, make sure that you review the films with them prior to that procedure. Make them show you what they think is causing the problem and what their injection is going to do. And make sure you keep a log of what injections you're getting. Because unfortunately, this gentleman has untreated whiplash and a musculoskeletal strain or sprain. He does not have an underlying neurologic condition, and for a 27-year-old, his discs are normal, and he has no nerve compression, and he has no facet disease that would warrant any of the procedures that he had done. So the recommendation for him is going to be deep tissue massage and then focused therapy and training on a musculoskeletal strain or sprain, with increasing his activity level and getting his exercise back to where it was prior to the accident. So moving forward for patients out there, if you're not feeling as though your treatment is making sense and you're getting all these procedures done and they're coming at the request of either your attorney or your pain management doctor or your therapist, and you're getting treatment that you don't feel makes sense, please seek out a second opinion so that you can be sure that what you're having done to your body makes sense.